Good morning, everyone, and welcome to Live with the County of Santa Clara. I'm Maribel Martinez, the Public Information Officer here at the Emergency Operations Center. This morning, we're joined by Dr. Marty Fenstersheib, our County of Santa Clara COVID-19 testing officer. And in just a few moments, we'll be discussing the growing number of COVID cases and who is impacted the most. Also, we'll provide information about resources and focus on the solutions to how to stop and slow the spread of COVID-19. We're going to take a look at our dashboards, but I'll share today that we are keeping our masks on today. We really want to bring home the message that we need to be wearing masks that cover our nose and our mouth every day, anytime we are outside of our home. So we thank you for your patience. We might hear a little bit of a muffled sound because we're keeping these on, but we, again, want to make sure that everyone knows how important it is to wear masks every day. The numbers, as we have them as of yesterday, we have 9,359 confirmed cases, 158 new cases, 185 cumulative deaths, and 1 new death as of yesterday. And when I share these numbers, I want us to remember that every case is a person, every person is part of that family, and those families are part of our community. Now, Dr. Marty, we see these numbers, we hear these numbers, we might even know people in our network, but there's still some folks in our community that don't believe this is real, don't believe the pandemic is real. What do you tell them? What do you say to them?
Well, sometimes in our own neighborhoods, excuse me, we don't see evidence of COVID-19, but I assure everyone that this is very real, and for a lot of people who have experienced the illness, and for a lot of people who have been hospitalized, it's very real. So COVID is in our community, it's in the state, it's in the country, but it is here in California, it is real, and it's with us every day, and I hope things will get better over time.
So let's look a little bit deeper into the data, and let's show some of these dashboards. And for the public, some of these dashboards, all of these numbers are on our dashboards. They may look a little bit different on our website posting, but let's look at what the data is telling us.
Okay, so this is a bar graph showing cases by race and ethnicity. So it's the breakdown by who you are in your community. So it's Asian, Latinos, whites, African Americans, and others. The first thing you want to look at is the light blue bars, and that tells us the percentage of all of us as part of the whole population. So, for instance, Asian make up 36% of our population, whites make up 32%, and I would note that there is not one group that makes up a majority in our community. We are a community of minorities, if you want to say. One other thing, where do we get this data? We get this data from the census, and that's coming up again. So a little second message here, please fill out your census. It's very important for us to have this data. The other important part, again, is the cases. Where are the cases, and who are the cases? And you can see in the blue bars, number one, that blue bars are in every group. So COVID-19 affects all of us, every one of us in some way. However, we're going to point out today the Latino bar there. The Latino population is 1 in 4 of the people that live in this community are Latinos. However, of all the cases that we've identified, the 9,000 and some cases that Maribel mentioned, almost half of them, 1 in 2, are Latinos. So again, 1 in 4 Latinos in the population, but 1 out of every 2 cases are Latino.
So that means that when somebody tests positive in our county, 1 out of those 2 cases, 1 of those is Latino.
That is correct.
And when we use the word Latino, we mean Latino, Latina, Latinx, Latine. Folks of that ethnic background, race, of all genders. This is really significant. And especially in the work that I do with the Division of Equity and Social Justice, we really are looking at ways that communities of color are impacted in disproportionate and in significant ways. And we also recognize that to do this work right, we have to engage in anti-racism work, meaning that we have to work really hard to undo some of the conditions that have created these biases in our community. That not the community itself is responsible, but we've been building on conditions that have existed even before the pandemic. Let's look at another data set about our county as well. So here now we're looking at a map of our county area.
So this is a map of Santa Clara County, again, the North County down to the south, Gilroy area. And the first thing that we see on this is that the colors represent cases and where people live. The first thing we see is that it affects all of our county. Every sector of our county, every area is affected by some level of COVID. However, if you look at the darker blue areas in the South County, and then in areas of East San Jose, that's where the highest concentrations of COVID cases are. Again, it's everywhere else, but in those areas, there's more cases than any of the other areas when you start looking at neighborhoods. So South County, Gilroy, and then the east side of San Jose.
So this is significant because every part of our county in some way is impacted, right? There isn't an area that does not have a case. We're all impacted, and it's even more so in some areas. You know, I grew up in East San Jose, Story and King area. My mom, my sister, my nephew live in Evergreen. And on my wife's side, we have family in Gilroy. So these are our families. This is our community that we need to protect, and we need to be aware of all the challenges that folks are facing in our county.
Yeah, I totally agree. I mean, we're all affected. I'm concerned. My family isn't here. I grew up back east, and my dad, who is in Florida, where COVID-19 is out of control, he's 93 years old. And so I worry about him. I worry that he'll come into contact with somebody who's infected. So I basically call him every day and say, did you go outside today, and did you have your mask on? And every day I just check on him. So I think we all do that no matter where you are, but I think it's our responsibility, it's all of our responsibilities to take care of each other and protect our families as best we can, always.
Absolutely, and you mentioned that your father is 93. My mom is 72, years young. Let me underscore that, years young. She will remind you of how young and vibrant she is. And we have to protect our community members and our family members. So let's look at the age breakdown of the data.
So again, this is the cases by age group, and you can put yourself in one of these age groups because we cover every age group, and there are cases in every age group. I think of note, really, is that whereas before we used to think this was a disease that affected the elderly in our community, and granted, that's true. And in fact, the people that are in hospitals and the people that get the sickest are usually the elderly. However, if you look at all of them put together, that if you add up the cases in the young people under 35, you'll find that half of our cases, 50%, are under 35. So it's not a disease of old people. It's a disease of all people, especially the young people. And the young people who may not have a lot of symptoms or feel sick all the time, and maybe with no symptoms, can still bring that disease home to the family and your mom, my dad, and again, not willingly or knowingly sometimes, but they could potentially infect them if they're not really safe.
Yes, I think about that because my mom lives with my sister, my younger sister, and my nephew, who is 5 years old. And so we have a household that's multi-generational. That my sister sometimes has to leave the home to do grocery shopping, things like that. And so we're very cautious of the fact that we have multiple age ranges in a single household, and we have to have precautions, take precautions to make sure everyone's safe. What are some of the things that multi-generational homes should be thinking of in keeping all of our community safe?
Well, Maribel, you make a very good point. Again, depending on where you live, I mean, maybe you have a large house and there's only a couple people in there, but many people live in communities and neighborhoods where the families are living in very small quarters. Maybe there's an extended family. Maybe there are more than one. Maybe there's more than one family. And if somebody comes and infects who's young, like we talked about, comes home, and there's people that are older and perhaps at higher risk, what can you do? Well, even though we love our families, we want to hug them and kiss them, in those cases, we really have to be careful. The new normal is we don't run over to our grandpa anymore and hug them. We try to keep our masks on. We can even open the windows because we know it's safer outside than inside. So that's one way of doing it, and we try to keep as separate as we can. So that's, in order sometimes to protect and to love our families and take care of them, we have to keep separated, which is different than what we usually are used to.
You know, I think me coming from a family of immigrant parents, we definitely understand that families have sometimes made decisions to move away or have a lot of physical distance, and we do that for the betterment, for the future, right? To have a better future. And so this notion of staying away as a way to show love is actually part of what we've done before too. So just wanted folks to remember that as well. We know that frontline workers have a higher risk because they're interacting with the public. But could you share a little bit more about what do we mean by frontline workers? That's kind of a new term that's being used.
Frontline workers, or people used to call it essential workers. Basically, we're looking at people who take care of us. When we go shopping, they're the people that are stocking the shelves, checking us out. They're the people who drive the buses. They're the people who are working in the restaurants. Those are frontline. They frontline facing us in the community. And they put themselves at higher risk every day when they go to work. And again, they have to come home to their families. And we do know from our other data that, again, the Latino population is overrepresented in the frontline workers. So we see more Latinos that are working in the front line. And because of that, because of their work and helping us and serving us, they put themselves at higher risk, and therefore they potentially put their communities at higher risk, their families at higher risk also.
And I think that's a great point. And that also means that we all have a responsibility to keep those frontline workers safe by us following all the prevention measures. And a reminder that not one person can defeat COVID-19. It takes all of us working together. And again, if we were really interested in doing transformative, anti-racist work, we have to make sure that we keep our communities of color, our vulnerable populations safe, and that includes our frontline workers. Because many of them are in positions that maybe don't have job protections like sick leave, or if you don't show up to work, you are losing pay or are perhaps not being able to come back to a job. And so we have to really, really think about our actions in ways that we can prevent the spread of COVID, especially for those that are serving us in these frontline positions. So we are now entering this new normal because COVID is real and we're doing things differently. I know that I perhaps have not been following some of the methods that my mom would like, which would be to visit her every single day at home, because we are keeping this distance. What are some other things that we can be doing to lower risk in this new normal?
Well, as we all know, and I think we keep talking about wearing these masks, and we have them on today to show, again, that this is what we do. This is our new normal, and that's the way it should be for the entire population. I think that if everybody wore these masks 100% of the time, we would see our case numbers drop tremendously. So don't take it lightly that these masks aren't important. They are very, very important. So remember, no matter where you are outside your house, you need to wear your mask. And then again, we talked about meeting other people. We want to make sure we keep our distance. Outside is always better than inside because we know that having the air and the breeze, it's less likely that we'll be infected. So I think those types of things. And then trying to not visit people at higher risk, or at least maybe calling them on the phone more, maybe saying hi from a distance outside as opposed to going in and giving them a big hug. And then I know people are having birthdays come up and parties. I know it's hard for people not to get together. That's what we like to do. We get together. But we have to be aware of the risks that people put themselves into. So put on that mask, keep your distance, and do more things outside.
And as you've seen, I've had to adjust my mask a couple of times during our interview because as I'm talking, it shifts around. And we want to make sure that the mask at all times is covering our nose and our mouth. Those are the areas that we want to keep covered. And we might need to adjust here and there to make sure that it is securely on. I've also started to send my mom cards. And last week I sent her some flowers. And that seemed to really brighten her day. So even though I couldn't physically go visit her and have been staying away for safety reasons, there are lots of ways, even low-tech ways, that we can make sure that our loved ones know how much we are thinking about them.
You mentioned that the mask. I just wanted to reiterate that. A lot of times I've gone out in the stores and I'm seeing people with their mask below their nose. You know, I'm kind of walking around with that. Just remember that it's really important that it totally covers your nose, like you said, and your mouth. So maybe you can even, if people aren't wearing it right, you can kind of just pull it up and help them out, and it will help you stay safe.
Now, a lot of the times we give messaging about not interacting with people that are not in your same household, but we also want to highlight that there could be some additional risk when you have members of your house that are essential workers. What are some of the things that we need to remember if we are an essential worker and are coming home to our loved ones?
Right. So if we've been out there and perhaps we've been in an area that maybe we had not the ability to do such social distancing from someone else, maybe they weren't wearing a mask, so we put ourselves at risk. And I think coming home, we have to be aware of that. So again, keeping the mask on when we're near other family members at risk, making sure we wash our hands, changing our clothes. Again, it's more the respiratory exposure than things on you, but that could also be a risk. Opening the windows, as I say, is something, it's so simple, but again, it really goes a long way to do that.
And of course, as always, with a lot of other diseases as well, and just overall good health, washing your hands. Wash your hands frequently. Don't touch your face if you haven't washed your hands or used a hand sanitizer. So making sure that your face, your nose, your mouth is covered and that you're not touching it with hands that have touched something else.
Right.
So let's shift now to talk about our resources and the testing that we're doing in our county, again, to make sure that our community is safe.
Right, so again, there's recommendations out from the health department on getting tested, and we've really increased the amount of testing that's available in our county. We've done, I think, a great job, and a lot of times there is some delay in getting the test back, but we're working on that. We would like people, obviously, if you have symptoms of COVID, to get a test, and we want you to call your doctor or go to your provider for that. If someone told you that you were a contact of a case, then we want you to go and be tested. And then all those frontline workers, we really want you to go and get a test. We think on a monthly basis is good, not any more often than every couple weeks. All the health providers in the community are required to provide a test for you. We also have these pop-up sites that you can look on our website and find a location near you to be tested. So I think those are some of the things that you can do to be tested. If you are positive, the one thing we want you to do is answer the call when we call you to talk about it, because we have resources for you. Don't be afraid to answer our call. There's no the data that we use is not shared with immigration. There's no issue around that. It's all kept very confidential. So we want you to answer that call, and we can provide you with some resources if you have trouble staying at home, separated from other people in the family. If you need help with your rent, if you need help with food, we have shelter opportunities for you in the community. Just answer our call, and we will be able to provide that for you if you need it.
Here in the county, we are with you. We want to support you. So as Dr. Marty mentioned, we provide testing. If you don't have health insurance, we can connect you with health care. And if you need support, whether that's financial, with rent, or with food, we can connect you as well if you are a confirmed case of COVID. So we are here to support. Well, that's all the time we have today. Thank you so much. Thank you, Dr. Marty, for all that you've been doing. Thank you, community out there. Keep wearing your face covering, practice that physical distance, and wash your hands frequently. For any other information, please go to our website at www.sccgov.org/coronavirus. Please take care of yourselves and those around you. Have a great day.